Good morning, everyone, and thank you for joining me today. We're going to take a comprehensive look at opioid addiction, exploring its causes, the impact it has on individuals and society, and the various solutions being developed to address this critical issue. Our discussion will cover the medical, social, and treatment challenges involved in the opioid crisis, aiming to provide a clear understanding of this complex problem. I'm excited to share this important information with you. Opioid addiction is a chronic medical condition where a person compulsively uses opioids despite facing harmful consequences. It's important to understand that this isn't just about willpower. Physically, the body adapts to the presence of the drug, which means that when the person stops using, they experience withdrawal symptoms. But the challenge goes deeper than physical dependence. Psychologically, the individual experiences intense cravings and a compulsive need to seek out the drug. Opioids themselves come in various forms, including prescription painkillers, heroin, and powerful synthetic drugs like fentanyl. Over time, addiction changes how the brain functions, particularly in areas responsible for self-control and decision-making. These changes highlight why addiction is best understood as a disease, rather than a simple lack of willpower or moral failing. When we look at the causes of opioid addiction, several key factors come into play. First, genetics can have a significant impact. If there's a family history of addiction, the risk of developing an addiction is often higher. Then, there's the environment. Living in places where drug use is common or experiencing peer pressure can strongly influence someone's behavior. Another major cause is medical prescription use. While opioid painkillers are necessary for some, long-term use can unfortunately lead to dependency. Trauma and stress also play a critical role. Both physical and emotional trauma can increase a person's vulnerability to addiction. Finally, mental health disorders such as anxiety, depression, and PTSD often go hand in hand with addiction, making recovery more complex. Understanding these causes helps us approach prevention and treatment more effectively. Opioids work by attaching to specific receptors located in the brain and spinal cord, areas that control both pain and pleasure. When opioids bind to these receptors, they trigger a release of dopamine, which creates that intense feeling of euphoria. However, with repeated use, the brain's reward system begins to change. It starts to produce less natural dopamine, which leads to physical dependence. This means the body becomes reliant on the drug and experiences withdrawal symptoms when it's not present. Over time, tolerance develops, so higher doses are needed to get the same effect. This cycle significantly increases the risk of addiction and makes it very challenging to stop using opioids and manage cravings. These changes in the brain highlight why opioid addiction is so difficult to overcome. Opioid addiction is particularly difficult to treat because of several interconnected challenges. First, persistent cravings and withdrawal symptoms make it very hard for individuals to maintain recovery, which is why relapse rates remain high. Then, there are complications from mental health issues that often occur alongside addiction. These co-occurring disorders require more complex treatment approaches, and physical dependence means that detoxification must be done under medical supervision to be safe and effective. Finally, social and treatment-related barriers play a big role. The stigma surrounding addiction can isolate people and make it harder for them to find support. At the same time, many individuals face limited access to comprehensive treatment programs, which means care is often inconsistent or insufficient. This combination of factors frequently results in a frustrating cycle of relapse and recovery. When it comes to treating opioid addiction, medication-assisted treatment, or MAT, plays a crucial role. This approach uses medications like methadone, buprenorphine, or naltrexone to help reduce cravings and ease withdrawal symptoms, making it easier for patients to stay on track. Behavioral therapies, especially cognitive behavioral therapy and contingency management, complement this by addressing the psychological and behavioral aspects of addiction. However, there are significant challenges. Stigma and misconceptions about MAT often prevent people from accepting or seeking this type of treatment. Additionally, many individuals struggle with sticking to their medication regimen, which can undermine its effectiveness. Access to therapy services is also limited for many, reducing engagement and continuity of care. Even with the best treatments available, the risk of relapse remains high. highlighting the complexity of opioid addiction and the need for comprehensive and sustained support. When we look beyond the individual, opioid addiction has wide-reaching social and systemic impacts. Economically, it costs billions every year due to healthcare expenses, lost productivity, and the demands placed on law enforcement. Healthcare systems, especially emergency services, are often overwhelmed by the volume of overdose cases they must handle. Another significant barrier is stigma, which not only discourages people from seeking help, but also affects how policies are shaped and prioritized. On the policy front, there are ongoing challenges, including inconsistent access to treatment and debates about treating addiction as a criminal issue versus a medical one. Social factors like poverty, unemployment, and unstable housing further increase the risk of addiction and make recovery even more difficult. Ultimately, tackling this crisis effectively demands a coordinated public health approach combined with stronger social support systems.